Good day, folks. Alfie Vente here once again of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a wonderful day. This is a soft tissue case study, big toe pain. So this is our third case study that we've put out there. These are cases that are based on actual treatments that I've given. They're usually a combination of different treatments, and I combine them into one. I don't typically use just one-offs, but for the most part, I use these soft tissue case studies, based on numerous treatments that I've done over the years. There's typically patterns that I found. This I feel is a great way to exercise the mind for you massage therapists out there, potentially chiropractors and physiotherapists, physical therapists that really specialize or really focus in on the muscles and the fascia. This might be something that might interest you. If you like our content, please like, share, subscribe. Pass it on to those that you feel this might be helpful for. And also, if you're on YouTube, please hit that notification bell. We appreciate it. Also, I have to add, if you are an instructor and you feel this might be helpful for your students, we do invite you to pass this on. It would be really appreciated. So now let's talk about this soft tissue case study, big toe pain. And by the way, remember, this is part one. There's a part two where we talk about the answers and discussion. So I do advise, writing things down. Maybe if you got a pen and paper, your laptop, take some of these notes down. So here's your case study. Your patient client is an avid runner. By all accounts, they are in good health. Every once in a while, he notices pain in his left big toe. The pain gets to a point where he is finding that he either has to stop his run or at the very least cut down the mileage. Typically, he manages symptoms well with a combination of treatments, massage and physio. So this person, every once in a while, he'll feel the big toe acting up, goes in for treatment, and he is able to manage the symptoms. About 6 months ago, though, he also sprained his left ankle. This was his first sprain, and I say first because usually with the first sprain, I know I've sprained my ankle 3 times on both sides. The first one was horrible. It was the worst sprain. Initially, he felt that the healing went well and that he was able to eventually get back to his regular fitness activities. By the way, this is the anterolateral aspect of the ankle that we're talking about, around the sinus tarsi, the sprain. So, going further, fast forward to the current time, and he feels that the ankle seems to feel tighter and has become less mobile. He also stated that there is still some swelling in and around the ankle. He wonders why there is still some leftover swelling because months have passed since the injury. So I want to add that it's not overly significant swelling, like it's not like a balloon, but there's enough swelling that you notice it, compared to the other side. And this person's wondering why this thing is not going down. It just seems like it's constantly there, the swelling. He has seen his doctor and other specialists and has had scans done along with other Western medical tests, and all are negative. So there isn't anything there that they've found that is out of the ordinary in regards to something like deeply pathological. At the moment, the 2 key symptoms that he's noticing is the big toe pain along with the ankle swelling with seemingly decreased mobility. So when he moves his ankle, it feels like it's not as mobile as the opposite side. It also seems that the big toe pain has become more frequent with increased intensity and generally becomes more symptomatic during a run. So that's gotten worse. It seems like it's coinciding with the swelling in and around the ankle. So now let's take a look at the key observations. The ankle looks swollen, and on palpation there is noticeable fluid located around the left sinus tarsi to the dorsal aspect of the foot and just slightly superior to the ankle joint. On palpation, there are severe restrictions of the fascia, so restricted that it feels like the connective tissue is wrapped tightly around the lower leg structures. There's restrictions extend inferior to the knee to the dorsal aspect of the foot. So if you've ever palpated very, very tight fascia, you will understand this. Like, it's hard to grab. There's not much motion. It feels like it's really, really wound tightly. I call it like really tight saran wrap. So this is what this person's feeling. It feels like it. Well, this is what you're feeling as a therapist when you're palpating around the area that's mentioned here, that there's not much mobility in the tissues. Upon testing the length of the left plantar flexors, you observe that the left side is relatively more shortened than the right side. There is significant resistance on passive dorsiflexion. So when you're doing the passive dorsiflexion, you feel like there's a lot more resistance on the left side relative to the right side. Testing both active free and passive range of motion of the left big toe, you notice that extension is limited. So the big toe too, there's some limitation in terms of when you are extending the big toe. This is again relative to the opposite side. The big toe looks slightly more flexed. On the medial and plantar aspect of the distal phalange of the big toe and on the metatarsal head, there is a noticeable callus. This is very important. As a therapist, when I'm working on people and I see these things, this triggers, and you'll see when we talk in the answers and discussion portion of this case, what I mean by this. But it is, for me, a very significant thing when I notice like calluses in particular areas. It gives me clues. There is some tenderness locally at the big toe, generally very mild. That's also important too. So like, you're touching the area, yeah, it kind of hurts, but it's not really that significant. This is relative to what this person feels when they're on the run. It actually feels a lot sharper, a lot more intense. Palpation of the anterolateral aspect of the muscles of the lower leg, you notice increased tightness relative to the opposite side, and that a certain pinpoint section seems to reproduce the pain into the big toe. When I say pinpoint, the person, you are digging your finger or your thumb into a certain section, and it's causing a referral down into the big toe. All other Western tests are negative. So, these are the critical thinking questions that I want you to think about and also write down and think about this for a week because, again, we have the answers and discussion portion of this case study. What do you think is causing the pain in the big toe? What do you think? Write it down. What is your theory in regards to why the swelling has become chronic and that it has stayed static in the location? So in other words, why is it staying there and it doesn't seem like it's moving? It's constantly there. As we talked about in the observations, you notice that there's swelling there. It's not a lot, but you can notice a difference between the left and the right sides. List 3 objectives in your treatment plan and the reasons for why you have chosen these objectives. So basically, these are the things that you intend to do to make this person better. What are those 3 objectives? There's probably 4 or 5. You could probably write down 6 or 7, but these are 3 of the most important objectives that you will have in regards to treating this individual. And finally, number 4, what is your understanding of the pathophysiology of the pain of the big toe and the chronic swelling? What is your theory in regards to how this person got to this point with the increased pain in the big toe and the chronic swelling in the area? What is your theory? In the next video with the answers and discussion, I will ask, if you have a theory to comment below. So those are your critical thinking questions, and you have about a week to think about these things. So, as I mentioned before, the answer and discussion video will be the week of September 23rd on LinkedIn and YouTube. So pay attention to any announcements regarding the answers and discussion. Thank you for watching this first part of this case study. We really appreciate it. Please like, share, subscribe, pass this on to those that you feel this might be helpful for, and also hit that notification bell if you're on YouTube. Also, please follow us on our social media. You can visit our website, ventepainrelief.com, and also our other website, vprc.ca. There's a lot of great content there for patients in regards to clinical issues, treatments, so on and so forth. My name again is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. We'll see you in the next video, and thank you again for watching. Have a great day. Take care.